Welcome back to the Mastering Your Fertility podcast. The show is all about reclaiming health, enhancing fertility, and preparing for pregnancy. We're Kristin Cornett and Dr. Haley Nye, your hosts and the creators of the online fertility platform, Tiny Feet. If you're here for the first time, then welcome. We are so glad to have you with us. At Tiny Feet, we use functional medicine and nutrition to help couples overcome fertility struggles, conceive successfully, and have beautiful, healthy babies. We offer individualized consults that include functional lab testing and targeted natural therapies, as well as an online fertility assessment and online courses. If you're interested in learning more about how we can help you on your fertility journey, we invite you to schedule a free 20-minute phone consult with us. You can find the link to schedule with us and learn more about what we offer on our website at tinyfeet.co. And speaking of online courses, we are actually putting the finishing touches on a course that will take you through everything you need to know to prepare for a healthy pregnancy. More details will be coming out about the course soon, so stay tuned to learn more. And we will be having an early bird release for the course with special pricing just for our email subscribers. So if you're not on our list yet, we highly encourage you to sign up so that you can be the first to hear about that early release. And you can get signed up for the list through the link in the podcast episode description. Okay, so just one more thing before we get started on today's episode. We'd like to give a shout out to one of our listeners who left us an awesome review on iTunes. Christina Howard 210 wrote, "This is my favorite fertility podcast to listen to for so many reasons. Dr. Haley and Kristin address a variety of topics, invite interesting doctors and specialists to interview, and go in depth about ways to improve your fertility besides running straight to IUI or IVF. You can tell they genuinely care about women's health and improving it. They also have an amazing website with blogs and different medical testing and services they offer. They've given me so much food for thought and encouragement through my fertility journey. I would recommend this podcast to any woman, but especially those trying to conceive." Well, thank you so much, Christina, for sharing your thoughts and appreciation with us. We are so happy that you're finding the podcast helpful and encouraging. For all of our listeners out there, please consider leaving us a rating or review on your favorite listening app. It totally makes our day to hear from you, and it also helps boost the podcast so we can continue to empower couples with functional health and fertility knowledge. All right, so let's jump into today's episode. You're listening to episode 33, where we're going to be talking about food sensitivities and elimination diets. So you've probably heard a lot of different recommendations out there for which foods you should avoid when trying to conceive. And this week, we want to help you understand when you should consider making changes to your diet, which foods can commonly cause problems and why, and the two different types of elimination diets that we most commonly use with our clients. So you're going to learn what food sensitivities are, how they happen, and why they're so problematic for fertility. You'll learn why gluten and dairy get such a bad rap and whether or not you should consider avoiding them. The basics of the Whole30 and AIP elimination diets and when we recommend these to certain clients, and also when it might be time to seek out additional testing for food sensitivities. All right, so let's start out by talking about what food sensitivities are and how they happen, and Dr. Haley is going to do that for us.
Great. Thanks, Kristin, so much. Okay, so we have 3 different types of reactions to food. So it's really important to understand the difference. And so our immune system makes up the reactions that we're referred to is caused by antibodies. Usually they're like the trigger for the immune response. And you probably have heard of antibodies, but there's different types of antibodies. And one type that causes one of the food sensitivities or food reactions that we're going to talk about is IgE antibody, and this causes an immediate and often severe reaction to food. And so if you have one of these allergic reactions to food, you definitely are aware of it. So this is something that this is what's commonly known in the conventional medical community. And so when you go to a conventional doctor and they're getting allergy or offering allergy testing, this is the type of allergy testing that they're going to offer you. So that's like when they, do pricks on your skin and see if you actually have a reaction that's immediate on your skin, causing like a hive or a rash or swelling. And so this type of reaction is pretty dangerous for people because you need to have like an EpiPen on board. Your tongue can swell up. You have a severe asthma attack that, and you can end up in the hospital or even die from these kind of reactions. So the other type of reaction that we have to food is the one that we're going to be going into today, is what's called a food sensitivity. And this is not caused by IgE antibodies, but it's actually caused by IgG most commonly, and sometimes IgM antibodies. So they're different types of antibodies created by our immune cells or our white blood cells. And this can cause often an immediate response or a delayed response, and it can manifest in a variety of ways in your body. So some of the ways that you might experience a food sensitivity is through digestive problems. So like acid reflux, surprisingly, is often a food sensitivity. Gas, bloating, constipation, diarrhea is really common, and abdominal cramping. Also, you can have skin reactions, again, really common. You can have rashes, hives, eczema. So if you had eczema as a child, oftentimes that was some type of food sensitivity that was going on. Rosacea, which is like redness on your face specifically, and then acne. Also, asthma, seasonal allergies, or chronic sinus problems. So postnasal drip, congestion, if you're constantly feeling like your nose is sniffly or your eyes are itchy, or you constantly get these sinus problems, that could be connected to some type of food that you're eating that your body is sensitive to. Some other symptoms include joint, muscle, or nerve pain, headaches or migraines, mental health issues. So things like depression, anxiety, or even PMS can be connected to a food sensitivity. And we're going to go into a little bit more on why that is. So that surprises a lot of people. They don't understand that the food that they're eating, or one particular food that they're eating, is actually connected to how they're feeling on a day-to-day basis. And then hormone imbalances, like estrogen is too high compared to progesterone. So you're not necessarily processing your estrogen well, and it's causing this abnormal relationship between the two of them. And that can definitely mess with your periods. And then, of course, that can lead to unexplained infertility for a variety of reasons. So that is a food sensitivity as compared to what a food allergy is. And then the third type of reaction you can have to food is a food intolerance. And so this has nothing to do with antibodies, actually. It's just usually has to do with your inability to digest a particular type of food, which can lead to unpleasant digestive and inflammatory symptoms. So a really common example is lactose intolerant, meaning that you don't have that lactase enzyme. So huge portion of the population does not have lactase to break down the lactose sugar, and then it causes a lot of issues such as gas and diarrhea and things like that. So that's why people can actually take an enzyme to help break down that food. It's pretty easy to be able to, get relief from food intolerances with like digestive enzymes. So, how do food sensitivities start? So they really do start with some type of gut dysfunction. So there has to be damage to the lining of our intestines. So remember that the lining of our intestines is actually like a big tube that goes through us, and it's exposed to the outside world. And the lining of our intestine is the only thing that's keeping us, separate, the inside of our body separate from the outside world. And so it's really important that we have a nice, healthy integrity of that lining. And so, Now, the lining is selectively permeable and is only supposed to allow fully digestive nutrients through. So again, it's going to be very selective to what exact nutrients that we're going to be absorbing and which ones are going to go on through past the small intestine and into the large intestine. So when we have poor digestive function, so one example is like low stomach acid, or if we're taking medications like the birth control pill, or if we're exposed to toxins, pathogens, so bacterial exposure, say you go traveling and you get exposed to like a food poisoning or something like that. And then chronic stress. So all those can lead to damage to the gut barrier, and it can cause what's called holes, right? So it's causing kind of a sieve to where things can get through. So larger food molecules, bacteria and toxins are then not necessarily allowed to pass through the intestinal wall. They sneak through the intestinal wall, and then they can get into the bloodstream or run into basically our immune army that's sitting right there on the other side of the intestinal wall. And that army is going to respond to these as foreign invaders. And so if they feel like they're foreign invaders, then they're going to produce antibodies to them. And that's where that IgG and that IgM comes into play. So what do antibodies do? So antibodies are going to cause inflammatory reactions in our body. So that's all those symptoms that I just listed out earlier. That's actually an inflammatory reaction that your immune system is causing, because it feels like it's under attack. It feels like there's something that's attacking your body, and then it's reacting to that. So why do food sensitivities matter for fertility? Why are we talking about this, Dr. Haley? So the inflammatory response to food sensitivities can lead to poor detoxification. So your body just feels overloaded, especially your liver. Also oxidative stress. So the more that your immune system is fighting something unnecessarily, the more collateral damage there's going to be in your body, which leads to, again, that oxidative stress. And then we've talked a lot about how that oxidative stress leads to poor health and sperm quality. So both men and women can have fertility issues when they're dealing with food sensitivities. And then it also leads to elevated cortisol because of the chronic physical stress that your body's under. It's going to release more cortisol from your adrenal glands. And then this can also lead to excess estrogen and low progesterone, which we talked about just previously, leading to cycle irregularities, a short luteal phase, poor quality in the uterine lining, so affecting implantation, infertility, and then also miscarriage. So it's something that's just not talked about often, but that can definitely be a cause. It also leads to elevated insulin. So hopefully you've been listening to past episodes and you know how passionate we are about making sure that you have good blood sugar control. But when you have chronic food sensitivities, it can lead to an elevated insulin response, which can lead to excess androgens like testosterone and DHEA. And that can disrupt ovulation and, of course, egg and sperm quality as well. It also can lead to fertilization and implantation issues, and then increase your risk of pregnancy complications and metabolic issues for babies. So that is no small thing that we definitely need to pay attention to that. And then lastly, food sensitivities, because there's that permeability in the gut lining, and the autoimmune or the response that we're having to foreign or to those food particles, it can lead to autoimmune conditions. So Hashimoto's, which is autoimmune thyroiditis, is a really common autoimmune condition that affects 1 in 10 women, and that increases infertility and miscarriage. And so we have talked about that previously. So Kristin now is going to talk to us more about specific types of foods that I'm sure you've heard about that we have been told over and over again to put, remove from our diet, but maybe you were not really sure why.
Yeah, thanks, Dr. Haley. So the first one that we're going to talk about is gluten. It's very common to see a gluten-free diet recommended for fertility and pregnancy. And we just want to explain a little bit more to you about why that may actually be a really reasonable suggestion. I think there are a lot of doctors and nutritionists that are kind of skeptical about a gluten-free diet for this because there isn't a whole lot of scientific research that specifically shows fertility improvement on a gluten-free diet. But we have a lot of mechanisms that show what gluten does in the body, and we have a lot of biological basis and some common sense as well to kind of tell us why that would be problematic for fertility. And so one of the major ones is autoimmunity, which is something that Dr. Haley just mentioned. And, autoimmune conditions are interesting in the way that food can sort of trigger those. When your immune system forms antibodies to a particular food, it's forming an antibody to a specific protein sequence that it recognizes in those foods. And what can happen is that you can have similar protein sequences in the tissues in your body. And so when your immune system forms antibodies to that protein complex in a particular food, you can also get antibodies that also mistakenly recognize proteins in your tissues. And that's kind of how we can get that's why gluten and thyroid disease kind of tend to go hand in hand as, a problem, and why we often recommend gluten-free and why many practitioners recommend gluten-free, especially if there's Hashimoto's or thyroid disease going on. So let's talk a little bit more specifically about what's the deal with gluten, because there's a lot of things going on here. It's not just its ability to cause or contribute to Hashimoto's. So what is gluten? Gluten is actually a protein complex that's found in certain types of grains, so primarily wheat, barley, rye, and triticale. And that gluten complex is made up primarily of glutenin and gliadin. And gliadin is the protein or the peptide chain that we're most concerned about when it comes to gluten. So many people, as I mentioned, kind of think gluten-free is a fad, but there is quite a bit of science behind why it's problematic. And some people are even more susceptible to having an issue with gluten. And that depends a lot on genetics, especially those governing the formation of autoantibodies. There are certain genes that predispose us to autoimmunity, certain genes that affect how well we repair our gut lining. And so gut barrier dysfunction is a major cause and contributor to food sensitivities as well as autoimmunity.
Well, you also have something that runs in your family, right? The HLA-B27 gene. Is that what you're referring to?
Yeah, so there are actually several HLA genes that can increase the risk for several different types of autoimmune conditions. So, things like ankylosing spondylitis, rheumatoid arthritis, celiac disease is another one associated with HLAs. Hashimoto's actually may be associated with an HLA gene as well. So there are several.
Yeah, I know that the HLA-B27 is something that's that runs in your family. And so just for the listeners out there, if you also have something similar, like a family diagnosis of ankylosing spondylitis or some other autoimmune condition, then it's something to consider of getting your HLA, which is basically a type of immune complex or like your unique marker of how your immune system decides to react to things. And so certain HLA complexes will react more than others.
And so that does kind of mean that you do need to be a little bit more careful with your diet and, a family history of autoimmune disease, which I have very significantly, especially on my dad's side of the family. His sister, my aunt, has multiple autoimmune conditions. He has multiple autoimmune conditions. I have a diagnosed autoimmune condition and some symptoms that are consistent with a few others as well. So kind of scary situation. And gluten is definitely a contributing factor in that autoimmunity. And so all of us tend to be really careful with that in our diet. So celiac disease is what most people think of when they think of an issue with gluten. They think of this autoimmune condition. But that's not the only way that people can be sensitive or reactive to gluten. So celiac is actually triggered by gluten. It leads to the immune system to basically attack a specific type of protein that's produced in the gut lining. And that causes damage to the little villi, or the projections that increase the surface area of your gut and absorb nutrients. And so people with celiac disease tend to have problems with malabsorption. They end up nutrient deficient, which can cause a lot of systemic symptoms. And they often, but not always, have digestive symptoms as well. So now let's talk about gluten sensitivity aside from celiac disease. So it is completely possible to have that sensitivity and even produce antibodies to gluten without developing celiac disease. So some of the reasons that that gluten is such a problematic food and that we do tend to produce antibodies to it is that modern wheat is really heavily hybridized. So we've taken multiple different strains of wheat and we've tried to make it more weather resistant. If you actually look at today's wheat compared to 20, 30, 40 years ago, my mom actually grew up in an agricultural region, and she has sort of seen the progression of what wheat used to look like, these 4-foot tall stalks, to this now like dwarf wheat that we have that grows quicker, it matures quicker, it's quicker to harvest, and it has built-in resistance from this hybridization to different pests, and it's more tolerant of, fertilizers and things that we put on it. And so that makes it easier for food production. But what happens when we hybridize like that is that wheat can actually form new proteins that actually didn't exist in either of the two plants that was used to create a hybrid strain. And so we kind of have this wheat that's not really recognizable to the original wild growing grain that we used to recognize as wheat. And so these kind of foreign proteins are more difficult for us to digest. Wheat is already by itself more difficult for us to digest because our human digestive enzymes just don't do very well with the type of lectins, or we call it in wheat, they're prolamins. We just don't digest those very well. And so those lacking those digestive enzymes, we don't do a good job of fully breaking down these foods. And basically what that does is that causes these more intact proteins to interact really strongly with the gut lining. So we can end up with an increase in that intestinal permeability. Gluten specifically, or gliadin specifically, increases something called zonulin in the gut. And zonulin, what it does is it unravels the tight junctions between cells in the gut lining. So if you think of, like little gates in a fence, and basically what that zonulin is doing is it's opening up the gate in the fence and allowing something in that shouldn't be allowed in. So when that increase in intestinal permeability happens, that can increase the body's response to specific foods. So it could be reacting and forming antibodies specifically to gluten, or that gluten could be allowing other foods in that you're then forming antibodies to. So gluten can also cause dysbiosis in the gut by disproportionately feeding the wrong types of bacteria. So when we have foods like gluten that are harder for us to digest, what's left of that protein and the sugar and everything that's part of that food actually feeds bacteria in the gut as it goes through undigested. And that can definitely cause us to basically have fewer of the beneficial bugs that we want and more of the kind of harmful or more pathogenic bacteria that we don't want. And that can cause problems in the gut as well. Also, another important thing to note about gluten, and I've seen a lot of articles about this recently, is, is it the gluten or is it the glyphosate? Lots of articles that are kind of saying, well, it's more what we spray on wheat, or, the environmental treatment of that grain that makes it harmful to us. It's not that we're inherently reacting to gluten, but we're actually reacting to glyphosate. So glyphosate, for those of you who don't know, if you haven't heard all the controversy around that recently, glyphosate is the active ingredient in the pesticide Roundup. And although this isn't as heavily used in the actual growing process for wheat, it's actually sprayed on it toward harvest as a desiccant. So it dries out that grain faster. for harvest. And that's really, really, really common, even though it's not sprayed on it often throughout the growing season. But glyphosate is very toxic. I'm sure some of you have heard about the lawsuits now linking it to cancer, but it's basically like an antibiotic in the gut. It kills off beneficial gut bacteria, so it destroys those beneficial bugs, and it allows for then all that undigested gluten and other foods that are going through the gut to feed the wrong types of bacteria.
So I was going to mention something about, because I keep thinking like, well, why can we go to Europe, overseas and eat wheat and not have the same symptoms? So I know a lot of people have experienced the same thing, but when I went to Europe a few years ago now, I was able to eat wheat. In Italy, you definitely want to have a pizza here and there. And so, and the pasta, but I think you hit on some really good points of why that might be, is because they're probably not hybridizing as much as we have in our agriculture for the same, they have different ways of doing that, and probably just not using our same aggressive techniques in our agriculture. And then also they're not using Roundup, right? I mean, that could be a big piece of it.
Yeah, it depends. I don't think it's definitely not used as widely there as it is in the US. I don't know exactly what the rules are about what's banned. I know a lot of GMOs aren't allowed.
Right.
So, things like corn, which would be heavily sprayed with glyphosate. Yeah, I don't know about the treatment of wheat, but I do know that they run a little bit tighter of a ship over there in terms of what they allow the public to be exposed to. Yeah, I've heard that a lot. I haven't personally experienced the ability to travel overseas and eat things that I couldn't normally eat at home. But I think there's a lot of factors at play. So one could definitely be food quality, lack of certain chemicals that are sprayed on there. Another one is definitely stress, though, because when you're on vacation, you're not as stressed, and stress does increase gut permeability and kind of reduce your resistance to environmental assaults, which may come from food or from other things. So I think that's interesting. I definitely have heard a lot of people mention that. We don't really know exactly what the deal is with that. I don't know if it's because the quality of the wheat is so much better. In some places, you are getting a little bit more of a traditional treatment of that grain as well. So like making a traditionally fermented sourdough. In the US, we make a loaf of bread in like 2 to 4 hours, and it should take at least a couple of days if you're really preparing that grain properly and you're actually allowing it to like rise and ferment, because that process breaks down some of the proteins that are more difficult to digest. So there's a lot of confounding factors there, but that's a really interesting point to bring up. And I'm sure that some people listening have experienced that. The answer is that we don't know for sure, but there are a bunch of things that could be at play in your ability to digest gluten a little better in Italy than you can here in the US. But, it's really interesting. I actually have an NTP friend who lives in Italy, and they have an extraordinarily high rate of celiac disease in Italy.
Oh, interesting.
Yeah. So maybe it's more about stress.
Yeah.
When we go on vacation.
Lots to research there.
Yeah, definitely. So, the main issue with gluten is that it really has a special ability, more than almost any other food that we've studied, to have a negative impact on gut health. And so that's really the reason that it's so heavily recommended to be avoided, especially in certain situations. And then testing for gluten sensitivity is kind of tricky. So gliadin, which is the main component, the main protein complex that we're concerned about, breaks into like 20 or something different fragments. And a lot of times when we test for antibodies, we only test for antibodies to like one of those fragments, like the alpha gliadin. And so that's not necessarily a complete test. You could test negative for gluten sensitivity with that test, but still be gluten sensitive. So the best test to really assess for gluten sensitivity and really look at antibodies to multiple fragments that could be causing gluten sensitivity is Cyrex Labs, but it's a pricey test. If you really need the proof on paper that you're gluten sensitive, that's probably the lab that we would recommend. But in my opinion, Dr. Haley, you can share yours here in a minute if you have a different one. But in my opinion, the best way to determine whether gluten sensitivity is a problem for you is to eliminate it from your diet. I would say a minimum of 30 days, with really ideally 90 days being a good elimination time frame, and see how you feel. And when I say eliminate it, I mean really eliminate it. There's no such thing as mostly gluten-free. If you're sitting in the boat right now where you're like, oh, well, I only have a little bit, or I only have a bite of this or a bite of that every now and then, unfortunately, gluten is one of those foods that just has a really strong ability to stimulate the immune system. It can take a long time to clear antibodies that you create to gluten from your system. So there is no such thing as mostly gluten-free. And the best way to really know if it causes a problem for you is to eliminate it and see if you feel better. And if you do, it's probably not a food that you should be consuming in your diet.
Yeah. No, I totally agree with you, Kristin. I would say the only thing I'd like to add is if you have a suspicion that you might have celiac disease, it is good to go through the testing to see if you have celiac, which I believe the gold standard still is a small intestinal biopsy.
Mm-hmm.
And the reason why is because when you're diagnosed as celiac, there's a lot of other health concerns that you need to address. Bone health is one of them, because if you've had celiac, we don't know when you first developed it, and you could have been losing bone. Help me, Kristin, with it.
Density.
Thank you. Bone density over time. You could have been losing bone density over time, and it's recommended to get a DEXA scan, which is going to get a baseline on that. And so that's just one example of when you have actual celiac disease, that there's other health concerns that you want to make sure to address. And I see this all the time, is that people eliminate gluten, they feel so much better, and they don't want to go back to eating gluten because you can't.
To find out if they're sensitive.
Exactly. Yeah. You can't get tested if you're not actively eating gluten.
Yeah, that's a really good point. And I completely agree with that. If you have any suspicion or concern that you have celiac disease and you're not yet eating a gluten-free diet, I would go through the process of getting tested for celiac. Yeah, completely agree with that. And so I didn't do that. I started on a gluten-free diet without being properly tested for celiac. And so I don't know. I mean, it does run in my family. It is a possibility that that's an issue for me. But I guess at this point, we'll never know. The other thing about celiac is that just going on a gluten-free diet, in many cases, doesn't fully heal the damage that's been done to the small intestine. And so knowing whether or not you do have celiac disease can help kind of guide a treatment plan for you that's specifically focused on healing the gut, because it does take a long time to heal the kind of damage that's done. And people who have celiac disease, which is autoimmune, there are other concerns and nutrient deficiencies and things that we would need to manage to kind of get your body into a place where you actually can heal that tissue normally. Things like vitamin D, and, making sure that you have enough iron, and B vitamin deficiencies, and things that can really affect your health long-term.
Well, yeah. And some of those autoimmune antibodies that is created by celiac disease cross-react with a lot of other foods as well, unfortunately. And
we're going to talk about that in a second.
So Cyrex Labs has a test to help with cross-reactivity too. So just one other reason why it's smart to know for sure if you have autoimmune antibodies creating celiac disease.
Yeah, definitely. So when do we recommend going gluten-free? So we talked earlier, Dr. Haley mentioned kind of all of these inflammatory symptoms and digestive symptoms that are associated with food sensitivities. And, if you're experiencing those on a regular basis, any of them, really, it's a good idea to try out a gluten-free diet. And we would generally recommend that to clients, especially those that are struggling with digestive issues, because of the damage to the gut lining, because of the increase in the incidence of dysbiosis with gluten-containing grains, any autoimmune condition, either suspected or diagnosed. We also frequently recommend it for endometriosis, as well as for unexplained infertility. And definitely for unexplained infertility, you would want to make sure that you're properly evaluated for celiac disease before trying a gluten-free diet.
Yeah.
Anything else you want to add about gluten before we move on to dairy?
No, I think you covered it all.
Other than the fact that like I said, eliminating it means eliminating it completely. And, like I said, having a bite of something here or there, there's no such thing as mostly gluten-free. But the other thing to be aware of is that you really have to label read, and you have to be aware of what things gluten is added to. Like, we found gluten in canned chicken that we were buying from Costco once. Like I think I first started a gluten-free diet just to experiment with it, totally not believing that it would help me at all, but I was desperate. So I started this in like the summer of 2013. And just so everybody's aware, it took me 2 weeks to start feeling any difference at all in my health. And it took me 3 months to really realize how much I had been helped by going gluten-free. But I had to get really diligent about label reading because any processed or packaged food that you're eating, it could be hiding in there. So, look for things like, certified gluten-free, look for it to be labeled gluten-free. There are a lot of different names on food labels that could potentially contain gluten, like modified food starch. There's nothing in those words that would make you immediately think gluten, but it's entirely possible that that food contains gluten.
Yeah.
And if it does, it's not labeled gluten-free and you don't really know what's in modified food starch, short of calling the company, there's not really a good way for you to figure out whether or not that food is truly gluten-free or not.
And that could feel overwhelming a little bit for people. And so I think just knowing some good resources, such as, I'll just give a little shout out for thrivemarket.com. They're great because you can go on there and click, there's a filter where you can just say, show me all your gluten-free foods. And they've done all the work for you. I mean, they'll post everything that you can purchase that you can feel comfortable knowing that they're gluten-free at that point, especially if you live in an area where it's hard to come by gluten-free products. That could be a good option for you.
Definitely. And they're totally worth it. It's basically like an online Costco membership for healthy food. And so totally. I think it's like a $30, $29.95 a year or something. And so you pay a membership fee, but you get discounted like prices on pretty much all different kinds of pantry staples, spices, snacks. They now have like cleaning products and personal care products. There's a lot of cool stuff on there. So Thrive's great. We love Thrive. One other thing that I want to mention about gluten-free, and one of the criticisms that a gluten-free diet gets a lot is that, you're going to be causing nutrient deficiencies by telling people to go gluten-free. And I really want to address this topic because that's crap. I'm sorry. I'm just going to say it right now. Like if you're really properly eating a gluten-free diet, like, yes, you could be causing problems if you're going from a gluten-containing processed food diet to a non-gluten containing processed food diet, because a lot of the gluten-free flours, they're not mandated to be fortified with certain nutrients. And so if the only place that you're currently getting, synthetic folic acid and cyanocobalamin B12 is from the pasta that you're eating for dinner every night, that's a problem. And that's something that we obviously address talking about diet, talking about proper supplementation. We address that in other areas of our business. We have a free course on prenatal supplements, and we're developing our course on preconception preparation that's going to contain, a whole lot of advice about really how to eat a nutrient-dense diet, whether it includes gluten for you or not. But there's nothing inherently nutrient deficient about a gluten-free diet. Gluten is not a nutrient-dense food. Grains, they do have some beneficial nutrition and some fiber, but you can actually get way more nutrition and way more fiber from non-starchy vegetables. So what we're saying is, if you're going to eat a gluten-free diet, make sure that you're eating a nutrient-dense diet that includes plenty of fruits and vegetables, quality proteins, healthy fats. Don't just go to eating processed gluten-free foods.
Yeah. So I have a question that's bouncing around in my brain from what you said earlier of like why you have to go 100% gluten-free. And so I just wanted to give a little bit more context on that for the listeners. So when you are exposed, we'll say, to gluten, let's say by modified food starch that Kristin was talking about.
In canned chicken.
Exactly. And this doesn't happen in everybody, but a good chunk of people, especially if you're doing an elimination diet and you truly want to know how you feel without gluten, when you get exposed to just a few proteins of gluten, your immune system is totally on the lookout. So when you've been eating a bunch of gluten, it's built up a huge army against that gluten protein, hence is why you have a lot of symptoms. And it takes a while for that army to kind of be like, well, I guess the gluten's all gone. I guess we can all go home now. But if you're getting exposed to just even a few particles, there's still, that army is still going to be there on the other side of the lining of your small intestine. And, they have binoculars and they see that little gluten protein, and they're going to shout out in the microphone to all the other, army and say, hey guys, look, I found one. It's in the corner. It's right here. And boom, you're going to have a huge inflammatory response again. So that's why you need to be 100% gluten-free, is so that army will go home. So it's not just sitting there waiting, and still continuing to cause problems for you.
And this isn't, with a lot of other, we're going to talk a little bit later about elimination diets, but this is not generally a food that I recommend reintroductions for. So if you find that you're gluten sensitive and you feel better without it, it's not typically a food I would recommend like eliminating for 3 or 6 months and waiting until you don't react to it anymore and then starting to eat it again. I just think that if you've already proven that you're susceptible to that sensitivity, we have so many things in our modern life that damage our gut lining. We don't need to be doing that with our diet. We don't need to be increasing intestinal permeability with a food that's not particularly nutrient dense and has a lot of other health concerns associated with it. So if you found that you are gluten sensitive and that you feel significantly better without it, I don't typically recommend adding it back into your diet at any point. Now, the next one that we're going to talk about is dairy, and I don't feel as strongly about dairy because I believe that dairy does have some good nutritional value to it. It's a great source of complete protein. It contains, good, healthy fat-soluble vitamins. It's actually been found, full-fat dairy products have been found to be supportive of fertility in multiple studies.
When they're great probiotics or fermented.
Yeah. Fermented dairy can be a healthy source of probiotics, but there are some concerns with consuming dairy, especially for certain people. So let's talk about what the deal is with a dairy-free diet, why we should consider it. And the first reason is that dairy is commonly cross-reactive with gluten. So the antibodies that we can form to gluten can also recognize dairy proteins, causing a similar inflammatory response. Now, there are other foods that can also be cross-reactive with gluten, and we'll talk about those a little bit later. But basically what that means is that if you're gluten sensitive, you are also frequently reactive to dairy. And so when you see people say go gluten-free and dairy-free, there's a reason that they get recommended together. And so we already kind of talked about lactose intolerance earlier, but lactose is just kind of generally not well tolerated by adults. There's only a smaller percentage of the population that still makes enough of that lactase enzyme in our bodies to properly break down lactose, and that can cause a lot of digestive distress, usually diarrhea, flatulence, gas. Yeah.
Matt's lactose intolerant, and he seems to be in denial sometimes. And so
I did not know that Matt was lactose intolerant. Then again, I've never seen or experienced him eating dairy, so good on me.
You don't want to.
So dairy products are also generally difficult to digest. They actually do have protease inhibitors in them. So digestive enzyme inhibitors that prevent protein digestion. So that can contribute to gut dysbiosis. It can contribute to damage to the gut lining. Also, the whey and the lactose in dairy can promote insulin release in the body. And I think that this might actually be one of the reasons that it's so heavily associated with acne in some women.
Mm-hmm.
So that's one of those foods that when somebody comes to us and says they have acne, dairy's on the chopping block. That's one of the first foods that we recommend at least trialing an elimination with to see if the acne gets better. And, I don't know that I've read a whole bunch of studies on this, but the mechanism between insulin and insulin's ability to increase testosterone production in the ovaries, I think is likely a big part of the reason that acne and dairy kind of go hand in hand in some women. Another thing to note about dairy is that depending on the type you're consuming, dairy can be really high in histamine, especially with like aged cheeses and, fermented dairy products like yogurt or kefir or sour cream, something like that, can contain a lot of histamine. And histamine and estrogen have a really interesting relationship. And histamine also can kind of fill your histamine bucket. And that's kind of going to be associated with allergic type reactions, those respiratory symptoms, post-nasal drip, sinus issues. So if you already have a lot, asthma, if you already have, so if you already have a lot going on in your gut, and your histamine bucket is kind of full, adding dairy on top of that can cause a lot of symptoms. And so personal story again, I had terrible seasonal allergies for my entire life. I could absolutely not function unless I had eye drops, nasal spray, and oral allergy medication every single day, every allergy season. It was absolutely miserable. And, going gluten-free helped a lot of things, but it did not help my allergies. But my seasonal allergies disappeared completely. Zero allergy medication after going dairy-free. So that was a big, I think it was, and cheese was like crack to me.
Oh, I'm sure so many people can relate. They're like, don't take my cheese.
Yeah.
I get it.
Yeah.
It took me a couple years to come to, just come to the fact that I have to quit dairy too.
Yeah, it's a tough one. Cow dairy and the A1 beta casein, which is one of the main proteins in dairy, particularly cow dairy, or the species of cow that most of our milk comes from. It's very high in that A1 beta casein. And it's just a highly sensitive protein for people. Like, we tend to be highly reactive to it. Cow dairy is actually one of the most common allergenic foods. I think it's one of the top eight allergens. Probably couldn't name all those off the top of my head. It would be like peanuts, soy, eggs, fish, shellfish, those types of things. Wheat is on there as well.
Corn.
Yeah. So cow dairy is one of those commonly allergenic foods. Most of us aren't getting, A2 milk or organic milk from our local farmer or raw milk. There's a lot of controversy about raw milk. If you really want to know more about that, I highly recommend Real Food for Pregnancy by Lily Nichols. She kind of talks about why it's pretty overblown to be super concerned about raw milk, especially if it's coming from a reputable local source that's, just very safe. And conventional dairy products also contain hormones and antibiotic residue from what's given to those cows. We just do that in food production. The point of that, the hormones are basically to help them grow faster and produce more. And, that's the whole point in modern food production, is to get more faster. But that does lead to consequences in quality, and it can affect the way that we react to those foods and the way that our body processes those foods. So those are kind of the big hitters with dairy, is the cross-reactivity with other food sensitivities, commonly allergenic, insulinogenic, so increasing insulin in the body with the lactose in the whey, and just generally not being as well tolerated by a lot of people. So typically when we recommend going gluten-free, we also recommend going dairy-free, at least on a trial basis. Like I said, I don't typically recommend reintroducing gluten if you feel a lot better without it. Dairy, I think once you've done some really good gut healing, you can try it. I usually recommend doing full fat raw, as close to how it comes out of the cow as possible. The other thing about raw dairy is that, people get all concerned about the bacterial content. Like I mentioned, it's a controversial food, especially for fertility and pregnancy, but it's actually not, it contains a lot of beneficial, probiotic bacteria when it's not pasteurized. And those things actually help fight pathogenic bacteria. So if pasteurized milk gets bacterial exposure during packaging, that bacteria is going to proliferate in that milk. Now, if there's a little bit of bacteria that gets into raw milk, there's actually all these beautiful enzymes and probiotic beneficial bacteria that can actually help fight off that pathogen. There's also enzymes in milk that can help you digest it. So the fact that people don't produce lactase, you can actually get some lactase in the milk that you're getting when it's raw. And heat denatures proteins and enzymes. And so you don't get those in a pasteurized product. So if you're going to reintroduce dairy, if you feel better without it, but you really want to try to add it back into the diet, I would recommend, full fat, raw, if it's available to you, if you can even get your hands on it in your state from a reputable, safe source.
It's like raw cheeses that you could start with. It might be a good option.
Yeah. And they do. Some places will sell raw cheddar just because it's more of, I guess, more processed, quote, processed in the sense that it's fermented basically. So you're not getting as much potential bacteria exposure. But like I said, I know this is a controversial topic. If you really want all of the statistics on raw milk, we're not trying to tell you to do anything unsafe. So highly recommend Lily Nichols' book, Real Food for Pregnancy.
Well, and what we're really talking about is eliminating the dairy for you know, 4 weeks, would you say 4 weeks, Kristin, or would you
I would say
go
same as
longer?
I would do it as long as you're eliminating gluten, which would be a minimum of 30 days, you know, with a goal of 90 days, depending on how reactive you were to start with. So if you have a lot of inflammatory symptoms from that initial list that we talked about in terms of food sensitivities, I would recommend going longer on the elimination, giving your immune system a break, giving your gut a chance to heal. People who are highly food sensitive also take longer to heal their guts typically because they're short on resources that they need to do that. And so it can take, you know, 3 months or so for you to get better enough to reintroduce.
Speaking of resources, at the end of this episode, we're going to talk a little bit about the elimination diets that we use with our patients and clients.
Yes.
But first, Kristin is going to talk about some other foods that can be problematic for some people. So we've talked about gluten and dairy, which are the most common, which I'm sure you've heard about. But here are some other foods that you may have not heard about or considered.
Yeah. So gluten-free grains, those are another category. Certain grains that don't contain gluten can be cross-reactive with gluten. So like we said, the same antibodies that we're forming to gluten can also recognize proteins in other grains. Grains, legumes, nuts, and seeds also all contain digestive enzyme inhibitors. So things that make it harder for our human digestive enzymes to fully break them down into their component proteins. And so kind of that undigested mass can feed dysbiosis and irritate the gut lining. So, you know, people who have a lot of digestive symptoms tend to suffer a little bit more with these foods. These foods also contain phytic acid and some plant lectins that we talked about, like prolamins and agglutinins. Now, there are certain ways that you can prepare these foods to make them easier to digest. And so our typical recommendation before eliminating these foods, what you could do is try to soak and sprout them. So soaking in water overnight, there's a lot of great instructions for how to do this online. We will also be including soaking and sprouting suggestions and instructions in our course that we have coming out soon. So we really cover diet in depth in that course, but grains, legumes, nuts, and seeds can be soaked and sprouted. So when we say sprout, what we're basically saying is you're germinating the seed. And when you do that, it breaks down those protective mechanisms that make them hard to digest. Because if you think about it, like a seed, the purpose of a seed is to germinate into a new plant. And seeds don't want to be consumed by animals, aka us.
Mm-hmm.
And so they have protective mechanisms to keep them from being broken down in the digestive tract, because theoretically, you know, we could just eat seeds and then they come out the other end and then they still germinate into new plants without being digested by us. And so when you soak and sprout, you start to break down some of those protective mechanisms in the seeds and it makes them easier to digest. It also increases the nutrient content, especially in legumes. Like the folate content of sprouted lentils, for instance, is like 4 times the amount of just regular dried lentils.
Mm-hmm.
So something to consider. So better nutrient content, better digestion, changes the taste a little bit too. I personally think like nuts and seeds that are sprouted have a little bit of like sweetness to them.
Mm-hmm.
It's like not necessarily the exact flavor that you're used to, but I think it can be really, really beautiful.
Yeah, they do taste good.
Yeah. Also, sugar. I don't know how many more times we can talk about sugar. I feel like we address it every single episode on the podcast. But just as a reminder, sugar is an inflammatory food. It's not healthy. It spikes our insulin. It leads to insulin resistance. That leads to hormone imbalances, increases in testosterone, metabolic issues, weight gain, other hormone imbalances.
The reason why we're bringing it up is because people can be very sensitive to sugar. It can cause an inflammatory response because of the immune system. And so we wanted to make sure that it's listed under these other foods that people can respond to.
Yeah, refined sugar is not good for the gut. It feeds dysbiosis and it reduces bacterial diversity in the gut. And so that can all compromise the gut lining and the mucosal barrier that protects that gut lining. So sugar is definitely one of those foods that can be highly inflammatory. And that is why it is listed as problematic. Not necessarily problematic for some people, but probably problematic for all people depending on the quantity. So some people can handle a little bit more in their diet, preferably natural sugars, not like refined sugar or high fructose corn syrup. Another category of foods would be nightshade vegetables. And this one's kind of interesting. These don't affect all people. This isn't as common of a sensitivity, but this includes tomatoes, bell peppers, and hot peppers, eggplant, potatoes, tomatillos, paprika. There's like certain types of berries that are actually nightshades as well. It's like, was it goji berries? And it's like a particular type of huckleberry or something that's a nightshade, not the regular ones that you would buy. So nightshades are interesting. So they produce, actually most of the nightshade family, there's only a very small portion of the nightshade plants that are even edible. Most of them are poisonous, actually. So the ones that are edible still produce certain compounds that can be irritating in people that already have a compromised gut lining and just aren't particularly healthy or just have certain susceptibility. So I think some genes likely make people a little bit more susceptible to nightshades. And it's probably a protective mechanism that we've developed genetically. And it wouldn't be a problem, as like I said, in super healthy people with an intact gut lining and good digestive fortitude. But they contain things like saponins and glycoalkaloids, and those can increase gut permeability and stimulate the immune system. I find tomatoes to be one, like even if all other nightshades are okay, I find tomatoes to be one of the foods that tend to be really triggering for people. Yeah. And you can often get around that by eating them without the skins. Yeah. So peeling them before you use them in a recipe.
Right. Yeah, that's how they commonly do it in Italy.
Yep.
Once again, another reason to go to Italy.
Next category is eggs, which is both a common sensitivity, but also an extremely nutrient-dense food. We actually talk about eggs as one of our fertility superfoods, and we love eggs as long as you can tolerate them. So it is on that top 8 list of allergens. Can be very stimulating to the immune system. What's interesting about eggs is kind of learning a little bit more about the mechanism behind why they're a potentially sensitive food. So eggs contain something called lysozyme. And lysozyme has the ability to kind of form complexes with other proteins and can actually transport them through the gut barrier. So So the lysozyme can actually transport other egg proteins into the gut. So you could either be reactive to the egg itself, or it could just be increasing the transport of other proteins through the gut barrier and increasing sensitivity to other foods. So you could feel bad when you eat eggs because of the egg protein, or you could feel bad when you eat eggs because of the kind of the transport of other proteins through the gut. So eggs, if you tolerate them, are fabulous. If you don't, it's worth a trial elimination. This is definitely one of the foods that I would recommend reintroducing into your diet if you do find that you have a sensitivity, and just simply getting your gut barrier back up and running and in tip-top shape, rebuilding the mucosal barrier that protects the gut lining can usually resolve a sensitivity to eggs, unless you have crossed into IgE land, into full-blown allergy to eggs. And in that case, it's a lot harder to resolve.
IgE land. What a horrible place to be, huh?
Nobody wants to be in IgE land. And, just so you know, it's not doom and gloom. Like if you have food allergies, it is possible to resolve IgE allergies. It's just not as common to be able to reintroduce those foods. So if you have like deathly anaphylaxis to a food, that's obviously not one that we would recommend trialing back into your diet unless you were heavily supervised by a medical doctor.
Right.
And the last food, quote, food we want to talk about, which is another kind of tearjerker for people to have to eliminate, is alcohol. And alcohol isn't particularly awesome for fertility anyway, but one of the reasons that it can be so problematic and cause sensitivities in people is that alcohol is really good at increasing intestinal permeability. So unraveling the integrity of that gut lining. I learned recently, actually, that alcohol can also increase the transport of endotoxin through the gut barrier. So endotoxin would be like bacterial byproducts. So if you have a lot of gram-negative, a certain class of bacteria in your gut, they can produce something called lipopolysaccharide, or LPS, which is an inflammatory compound. It's really notorious for causing joint pain, actually, in people. and alcohol. So if you wake up creaky and achy and just feeling inflamed after a night of drinking with your friends,
like everybody.
yeah, it may not just be the alcohol that you're responding to, just because obviously alcohol is a toxin, but it actually may be the increase in the transport of LPS across the gut barrier that makes you feel so crappy the next day. So alcohol also has health benefits when certain types of alcohol have health benefits when consumed in moderation by a healthy person. But if you're struggling with the integrity of your gut lining and a lot of inflammatory symptoms, it is worthwhile to experiment with eliminating it. And when you add it back, go with moderation. And like we said, it's not particularly awesome for fertility. So we typically recommend going slightly less than moderation when you're actively trying to conceive. And then, of course, if you are pregnant, we do not recommend any amount of alcohol ever during pregnancy. There's, well, research has not been able to find any safe level of alcohol consumption that doesn't pose risk to your baby. So alcohol is a no-no during pregnancy. So now that I've just been Debbie Downer and told you all the foods that you might not want to eat, Dr. Haley's going to make it even worse and talk about, no, just kidding. We're going to talk about specific types of elimination diets. And so basically the two types that we use in clinical practice combine the list of foods that we've talked about in one way or another, and we use them differently in clinical practice. So Dr. Haley, why don't you kind of go into it? What do we do with an elimination diet, and which are the two that we like the best?
Yeah. So elimination diet is what us functional medicine practitioners / doctors will use to be able to discover what kind of foods you're sensitive to. So it really is the gold standard of figuring out your sensitivity. Now there's other tests that we can do. You may have heard of a test that we really like to do, which is an MRT, which will test like 170 foods and chemicals to see what your immune system is reacting to. However, the gold standard is just to remove the food and add it back in over time, except for gluten. And if you do react to it, because every person is different and the science just still isn't there to give us 100% accuracy on what you're sensitive to. So we do use it as a guideline, which can be helpful. So Kristin has mentioned that the minimum time frame that we recommend is an elimination for 30 days. And then depending on the severity of your symptoms, we may suggest up to 90 days. And the first one that we really like is the Whole30. So the Whole30 is actually originally, I think she created it. Do you remember the name of the person that created the Whole30?
Hartwig. Melissa.
Yes. Melissa Hartwig. Yeah, good job. So I think she originally created it as kind of like a detox kind of diet. I mean, I don't know if it was necessarily meant to be like elimination diet, but it works really well for that because it eliminates all gluten and grains. So all grains are out, all beans, so legumes altogether, dairy, all forms of sugar, alcohol, and food additives. Now, if that sounds really hard to you, yes, it may be hard, but the cool thing is the Whole30 has become so extremely popular. I imagine you probably have heard about it. It's become quite a community supported elimination diet. And so there's lots of resources out there to discover recipes. There's actually, you may have noticed that I didn't say eggs. So eggs is part of the Whole30 that you can eat. And some people are like, oh, thank goodness, because what the heck else am I going to eat?
For breakfast in particular.
But you may want to do like an eggless Whole30, just if you suspect that you might be sensitive to eggs, or if you just want to go a step further and just like really know if you're sensitive to eggs or not. There's a lot of recipes out there that are eggless Whole30 recipes, which can be a lifesaver. So it's only 30 days. I've done it twice before, and I've always done it with a partner. So it's fun to do it with somebody. And one thing that really helps you be successful on this diet is preparing your meals ahead of time. So being really intentional on what recipes that you're going to cook for the week, and setting aside 2 to 4 hours, like on a Sunday or a Saturday, to prep all your food ahead of time. And then it actually becomes not very hard, like yes, you go through kind of a sugar withdrawal or like a grain withdrawal, and you might not feel so great the first maybe 2 to 4 days, but resoundingly so, most people say that they feel great on the diet. And usually it's because they're eliminating something that they're sensitive to. So this is definitely our baseline recommendation for gut healing is a Whole30. And the reason why is because, again, it removes most of the common culprits for gut barrier damage and inflammation. And usually we discover what it is that you're sensitive to with this type of diet. So the other diet that we recommend is AIP, or autoimmune protocol. So this is a stricter version of the Whole30, or like a paleo diet that eliminates all the foods from the Whole30, but it also will eliminate nuts and seeds and their oils. So oils made from the nuts and seeds, seed-based spices, and this one eliminates eggs, and nightshades and their spices, and also coffee. So there's a lot of science behind this. There's some really great books that Kristin can mention when it comes to the autoimmune. Is it paleo diet or protocol? I mean,
you can use both.
Exactly.
It started out as autoimmune paleo and has kind of evolved into autoimmune protocol. So you can use either one.
Yeah. So with this particular diet, they focus on adding in a variety of highly nutrient-dense foods and correcting lifestyle dysfunction that can exacerbate inflammation and immune issues. And we recommend this elimination to clients with diagnosed autoimmune conditions if they have significant inflammatory symptoms such as skin rashes or migraines or
joint pain.
Joint pain is another one. And also if they have severe gut dysfunction. So if they're dealing with chronic bloating, diarrhea, constipation, abdominal pain, etc. And then also we'll sometimes recommend it for clients with endometriosis, because if you heard us talk about it before, endometriosis is an inflammatory condition that is now being linked highly to the gut lining and to the microbiome. So Kristin can give us a little more background on the AIP. I've actually never fully done the AIP myself, but she's been on it for a while and is very well versed on it. So maybe you can just give us a quick little snippet of your experience.
Yeah, AIP has been really great for me. I find that, I have some confounding issues and some additional immune system reactions. At some point, I promise I will share the full details of that on the podcast when I feel like we have a better handle on it, I think. So kind of what I'm dealing with is more of like a histamine intolerance. And so we think we may have identified the root cause of that, but it does make it difficult to try to manage symptoms with diet alone. So for a really long time, I would just I basically would just make my diet smaller and smaller and smaller, and the list of foods I could tolerate got tinier and tinier, and it got really frustrating. But AIP has been a great baseline diet for me to eat because it limits the amount of immune reactivity that I have to foods coming in. And so I can handle other stressors and health issues that I'm dealing with a lot better. So I do have diagnosed Hashimoto's thyroiditis. It has been helpful for keeping my thyroid symptoms under control. I'm actually not on medication currently. I'm managing with a glandular. However, caveat, I am not actively trying to conceive. If you are and you have thyroid issues, opt for medication. That is the safest way to make sure that your baby does not suffer any consequences from low thyroid hormone. So it's been great for me to be able to control my thyroid issues, to control other inflammatory symptoms. I have symptoms of Raynaud's, which basically affects circulation to my hands and feet. And I do suffer with, or used to suffer with, a lot of joint pain, and AIP helps me keep that under control. So at its root, AIP is a gut healing diet. And it's not just about elimination. Whole30 is a little bit more just about eliminating potentially offending foods. AIP is a little bit more about, yes, eliminating offending foods, but you can't stop there. You really have to add in nutrient-dense healing foods, because people who suffer from inflammatory symptoms and autoimmune conditions tend to be nutrient deficient. They tend to be protein deficient. They tend to just need a lot more of everything to heal and get their bodies back on track. And this is great for fertility because of the nutrient density of the diet. You know, you would think with something that eliminates so many different foods that it would be short on nutrients. But if you're really doing this protocol properly, you're actually going to be eating a more nutrient dense diet than most other dietary approaches out there. And so it is going to ask you to incorporate things like organ meats into your diet. Those are basically like nature's multivitamin. And that doesn't mean that you have to go out there and like eat an entire, you know, chicken liver raw, not raw, like cooked with salt or whatever, like plain.
That was a horrible image. Thank you, Kristin.
I meant plain, not raw. But it is going to ask you to start incorporating some of those really nutrient dense foods, bone broth, if you're tolerating that well, to help you heal your gut lining. Fermented foods, if you're tolerating those well. In a histamine intolerance situation, that was what was really hard for me at the beginning of all this, is like, oh, none of these healing foods are working for me. Like, I'm reacting to all these things that are supposed to make me better. That probably won't be you, so don't worry. That's like reserved for us special cases.
Extreme example.
Yes. Well, and I keep pointing that out because I don't want people to think that this is like normal.
Right.
To have to go through. But, you know, ultimately my experience on AIP has been very positive. I have been able to reintroduce a couple of foods and do just fine. I would say that my diet at this point is kind of loosely AIP. There are certain things that I do just fine with. The majority of foods like nightshades are a no-go. I cannot eat nightshades. I find, you know, the occasional experience with eggs seems to be okay, but that can go bad really quickly. But yeah, ultimately this is kind of my gold standard for clients with immune dysfunction. I'm actually trained as a certified AIP coach. I went through training in specifically how to implement this diet with clients to really get the full spectrum of what should be happening here. So when we're talking about eliminations, nutrient-dense foods, lifestyle dysfunction, we're talking about stress management, exercise, which can be really hard for people with autoimmune and inflammatory conditions. You know, just connecting, making sure that you have a network, that you're, you know, interacting with nature and just all the things.
Well, thank you so much for telling us your health journey that continues on and on. We're glad that she's starting
and on. Thanks.
No, she's, it's really great that how much you've learned and how far you've come. So we just want to wrap this episode up. Thanks so much for sticking with us with just telling you a little bit more about food sensitivity testing. So I mentioned it earlier that it's not the one test that's just going to give you all the answers. However, it can be really helpful in giving us a guideline on where to start, especially if there's some foods that you might be sensitive to that you would have never thought of, right? So there's some foods like strawberries or, you know, like, I don't know, caffeine. I guess caffeine's a bad example, but if you have other examples, that's
broccoli, beets, you know, things that,
there you go.
Yeah.
Exactly. So it can't catch all the foods, but again, that's why testing can be very helpful. And one of the tests that we really like to use is the MRT, like we talked about, and that stands for Mediator Release Test. And basically it's a blood draw, and they are testing to see what your white blood cells reactions are to certain food proteins. And if there's a low reaction, a medium reaction, or a high reaction, and then you get this beautiful report to show what your white blood cells are doing, basically. And then we combine that with our gut test, our stool test, which is the GI map. And the GI map is the reason why we use it is because it's the best available test on the market to evaluate gut health. And it's going to identify pathogenic bacteria, parasites, yeast, viruses, fungi, if anything is living in you that shouldn't be. It measures levels of beneficial bacteria, if it's low or if it's too high. You can have too much. It also assesses for functional digestive markers like stomach acid, enzymes, liver and gallbladder output, so how well you're digesting your food. It also measures immune and inflammatory markers. So are you leaning more towards a inflammatory bowel disease kind of picture, or do you have like where your immune system is more on the low grade where it's not necessarily working as well on the opposite end? And then there's also the fact that it's going to help us identify other underlying causes for health symptoms and fertility issues. And so that's why we really recommend the stool test, even though it may not seem like a logical first step when you're struggling to conceive, but it is. And you can actually learn more about why we recommend the stool test. We have an awesome blog article written on that that Kristin explains more. So we'll link to that in our podcast description. And I already talked about the MRT test. And so if you guys are interested at all, Kristin's going to tell us a little bit more about something.
Yeah, sorry. Well, I just wanted to talk about why it's so important to do these tests together. And so I will say that I don't ever recommend doing a food sensitivity test without a stool test. And the reason for that is because I kind of explained to you guys what happened to me, where I was just chasing down sensitivity after sensitivity, and my diet just kept getting smaller and smaller, and I just kept eliminating and eliminating. And the reason that I was doing that is because I wasn't addressing the root cause of the food sensitivity, which was gut dysfunction. And
Right.
I ended up having like parasitic infections that I had no idea were in there, and some other bacterial dysbiosis markers. And so the whole point is that, yes, a protocol that eliminates food sensitivities or an elimination diet can be restrictive, but it's temporary. And if you do it at the same time as you investigate and address gut health, you can get amazing results in a short period of time, as opposed to just chasing down food sensitivities. You eliminate those, you don't fix the underlying dysfunction, and then you can just start forming new food sensitivities, even though you've just eliminated a bunch from your diet. So I just kind of wanted to mention that. Yeah, but that's the reason why we use these tests together, and why we recommend them together, and why it's not a great idea to just test for food sensitivities without doing the underlying healing work. So that's all.
Yeah, totally. I think another potential option is that we'll make available on potentially the website, or if you book a 20-minute call with us, is doing at least the stool test, and then doing either a Whole30 or a AIP elimination diet too. That could be another option. You don't have to do the MRT, but a lot of people like the idea of doing MRT because, again, like Kristin was saying, it's just a faster course to recovery versus like a little bit more guesswork if you're doing the elimination. But the elimination diet is works really well for a lot of people. It really does. So if you do a 20-minute call with us, we can kind of get an idea of what would be best for you in your particular situation too.
Yep.
Cool. I think we're done.
I think we are. I think we covered all the things. So like we've mentioned several times, we would love to speak to you about your specific situation. You can absolutely book a 20-minute consult with us just to talk about that. We'll talk to you about testing options. You can also just like come to us and tell us what's going on with you, and have us kind of give you some recommendations about what next steps would be. I mean, you don't necessarily have to choose to work with us. You can, if you want our help, but we are also happy to just kind of hear a little bit more about what's going on with you, and kind of give you a nudge in the right direction based on what you're telling us your concerns are. So whether or not that's moving forward with doing some functional testing with us, going back to your doctor for some, tests that you can easily get with your primary care physician, whether it might be even exploring some conventional testing options, depending on how long you've been trying. So we can give you a lot of different advice in different areas. So, and we love to, meet people that are listening to the podcast and enjoying the content. So, schedule with us and get to know us a little bit. We'll get to know you and make some recommendations to help you on your fertility journey. Also keep in mind that brand new preconception preparation course, we haven't named it yet, so we're working on that. But that is going to be available
Secret.
soon. And we would love to see you on our email list so that you can be one of the first to hear about that and get access to some special early bird pricing when it comes out. So that course is going to go over a lot of different things, many things that we've discussed on the podcast in the past, but really kind of holding your hand through it, sharing our favorite resources for, working on eliminating toxins from your routine, how to talk to your doctor about preconception care, what tests you need, really in depth about diet, which surprisingly, we haven't really done a start to finish, like this is what your fertility diet should look like episode on the podcast. So some of this is information that we've never discussed before on the podcast. So lots and lots of cool things in that course. And we cannot wait to have that available for you. So we hope to see you on the list so we can get you priority notification.
Right. And next week, we are going to have Lauren Maneker on our podcast. And she is a registered dietitian who lives over in South Carolina, right? And
I think so.
She has many years of experience in working in the nutrition field, and she recently wrote a book on male fertility or male sperm health. And so we did an interview with her, and so next episode is going to be all about male fertility, which we haven't done in quite a little bit, right? So that's a really awesome episode. So stay tuned for that. And then if you want to stay in touch, please head over to Instagram and follow us at tinyfeet.co and say hi.